summer EBT program. And I am going to be stepping in and filling in and helping out on this process. So I just want to welcome all of you. If folks wouldn't mind, if you could possibly introduce yourself in the chat, name, pronouns, organizations, and your role, that would be fabulous. For today, we have a few things we want to talk about. We have the director's office updates. Claire Seguin's going to have a discussion, talk a little bit around some of the updates coming on, some of the transformation changes, and so on. We're also going to have some changes going on with some HR1 with OHP and SNAP updates. I think it'd be fruitful for folks to hear some of this. It may be a repeat for some, but we feel as though that these are oftentimes the families that we collectively serve, and it's really important to kind of get some of that message out and making sure that all our partners are mindful and supportive and aware of some of the changes. And lastly, just giving an opportunity for any kind of feedback and questions and ideas and things thinking that you may have on your end. Um, that being said, curious if anyone has any topics that they want to make sure that we call out today. We could put a pin in it, make sure we get back to it at the end. If you do have anything, you can either put it in the chat or you can raise your hand. I'm more than happy to take any kind of questions you may have. We did the kind of standard 7 seconds for a response. Didn't get anything, so we can keep going. Um, I do want to make sure that if folks do have any kind of questions, please know you can put it into the chat. We will monitor the chat. If we can't get back to you today, we will make sure we get back to you with any kind of questions you may have. So we want to make sure that we're being responsive to anything that's popping up for you. That being said, I would love to turn it over. Claire, I see you in the room. I'd love to turn it over to Director of Self-Sufficiency, Claire Siegman. Claire.
Hey Bill, hey everybody, thanks a lot. I have just a couple of quick updates today and then am completely free and interested in answering questions that you all might have about things that are going on in the SSP world. Mostly I wanted to talk about what's happening with transformation. I think there are a couple of things that are important, changes that are underway around here, and a couple of them involve SSP. The first one is that, well, for those of you who don't know, the Transformation Project is a project that has been in the works for nearly a couple of years now, really, in terms of all the information gathering and community feedback and client feedback. And then we went through a design period where we had decided what we wanted to try to do to serve Oregonians better, to make sure our staff on the front lines had all of the kinds of things that they need to do really good, solid work for Oregonians. And now we are headed into the implementation stages to some degree of some of these things. And one of the changes that's important for you all to understand is that there is going to be, as a part of the transformation, a new division, I'll call it, that is tentatively going to be called Unified Children, Adults, and Families. And it is where the SSP programs will live going forward once it's all official and final. So SSP has a home in the new world of the transformation of the agency, and that division is going to have a new director. It's a brand new position. So that has been posted internally only, and I'll tell you why, just in case you hear about it. This entire transformation is budget neutral. It is really an effort to use our existing resources and infrastructure without requiring any additional budget or without taking away anything from our budget. We already have enough challenges to deal with. So this is a budget neutral reorganization. And so the candidates who will be applying for this particular job are going to be coming from inside ODHS as it currently exists to keep it budget neutral. So there's going to be a fairly robust process. Some of you might have even been invited to participate in maybe a panel as we go forward. But it's a really new and important role in that it is going to be responsible for bringing to life the vision that the director has supported, that comes directly from community and participants to try to build a continuum of services that is more accessible, more user friendly, less siloed, and less bureaucratic. And that's really the hope and dream, I think, of this new office. The other thing about it is really going to uplift the upstream prevention connection to SSP work. So there will be a lot more conversation about, the efforts that we take and how we do funding and all those sorts of things to try to reach folks earlier so that we can, in fact, demonstrate the ability and effectiveness to keep folks out of other higher acuity systems in a really concerted, very organized, partnered way, both internally and externally. So you can imagine there's going to be a lot of information and opportunity coming your way to help build some of this out over time, especially once the new director is on board. Not sure what the timing is there. It was just posted on Monday, so I'm not really sure. I think it closes the first week of July. So it may, be a few months into the summer or what have you before the person is selected. But there will be opportunity to provide a lot of feedback because this division has an intention, it has a priority, but it's not been built yet, right? We are still in that stage. So just wanted to share that with you. So some of you might ask, as I did, what's my role going to be if there's no director of SSP? And so I wanted to also share with you that as time moves on and we start to stand up the UCAF division, there will be another area that's set up, and that's going to be called strategy and operations. And I'm going to be overseeing that particular body of work. And that's really the place where a lot of the implementation between programs and the service delivery side will take place. So I'll be working on things like uh, data sharing with regions and districts. I'll be working on some budget items. I'll be working on some implementation liaison roles so that we can make sure that the message that's coming out of program can effectively get out to the districts and make sure that everybody knows sort of which way we're all pulling. And of course, a big part of my role will be continued relationships with you all. It'll be continued relationships with tribes and other folks that are a key ingredient to the work that we all do together. So I'm very excited about the new role. The timing is still, like I said, a little up in the air, but I just wanted to share with you that my role will be changing probably after session. And the UCAF director will be coming on, and we'll be walking side by side probably for a little bit to begin to do the transition. So kind of a big deal. Any questions about that? Or any other questions about transformation that I could potentially share, shed some light on? Yeah, Beth, hey.
Hi, thanks, Claire. I'm sorry, I'm trying to find all the buttons.
Yeah, no.
Um,
I saw the hand. That's what counts, right? Yeah.
I was going to try to chat, but that seemed more
Yeah.
complicated. Could you give us a little more detail about I mean, we've been talking about breaking down silos for so many years. I've been around.
Yeah, yeah.
Could you talk a little bit more about what that will look like? How will it
Sure.
break down some of the silos?
Yeah, absolutely. So, a couple of big things are happening as part of transformation. So, one of the biggest and most important pieces of this is that there is,
Hi, Teacher Carmen.
oops, I think somebody needs to mute. We have established what we're calling the Office of Community Engagement, which is what I would say is the big umbrella over all of the service delivery work. So it's all of our offices, it's our districts, it's going to include some parts of APD, it's going to include this UCAF division that I'm talking about, the one I'm talking about for me in terms of implementation. And within that realm, there are also going to be regional hubs so that the 16 districts we currently have today will be a part of a new region. So they'll all be divided up and we'll have 5 regions, and regional administrative hubs will be established. And really what most of that is to try to do is to move the administrative functions to a coordinated place so that the folks delivering services and closest to the families that we serve, probably closest to you all as partners, can do that work more effectively without being bogged down by things that just kind of get added to their daily, that really could be handled by somebody else in an administrative hub kind of environment. So that's one really big effort. The other thing is that the organization is really working hard to try to establish efficiencies and processes so that, and I'm just going to use this expression, and I hope it's not offensive to anybody, but we're trying to not have folks need to learn how we make our sausage at ODHS, right? We want folks to be able to come in, get services, get everything they need, and not have it be a burdensome process the way it has been. We have heard loud and clear 100 ways we could improve. And I'll be honest, we're working on some of those ways now. And it's going to be the focus going forward so that you can maybe really truly have no wrong door in the end. I mean, this transition is going to take a while. It is not an overnight fix for an organization the scale of ODHS, but our intention is really to help the staff be able to do what they do best so that when we're serving families, they don't feel the lack of coordination. And I'll be honest, I mean, the thing that excites me the most about this, I've only been here 7 years, but in those years, I had never seen everybody sort of on the same wagon about this goal to try to make it a different experience from the customer experience side, hence OCE, Office of Customer Experience, right? I mean, everybody is pulling in the same direction about efficiencies and processes that are easier to follow, communication tools that are easier to understand, more back and forth so that if we're blowing it someplace, we actually hear from folks, you are blowing it. And then we work on it and we loop back. So there are a lot of, sort of philosophies we've talked about. You're right, Beth. I mean, totally. We've been talking about it for a long time. And now we've got everybody in the agency really pulling in that direction from the transformation aspects. So it's going to be hard and we won't get it perfectly right. And we're going to learn and we're going to adapt. And part of this is about an iterative process. We keep using that phrase a lot. But we're very well intentioned and we're restructuring in order to actually live out some of these vision dreams that we've had. Just for an example, one of the things that I think you might appreciate is that we have reorganized our data departments really into two new entities. That's very exciting. One of them is focused on sort of impact and research, and the other one is focused on data and reporting and dashboards and all of the things that we all really know we need to make good decisions and to be responsive when we get feedback. That's a pretty big investment. The other one, and I don't mean in new dollars, I just mean in terms of philosophy and thinking, right? We've reorganized teams to focus on those areas. I think, part of what this means is that we are committed to some accountability and outcomes and tracking all of that in a way that can be external facing. There's going to be new dashboards that y'all get to see and a whole bunch of other really great sort of outputs of this work that I think will be really beneficial for us all. So I don't know, it feels like a challenging time, but also maybe an opportune time to be doing this rethinking. I mean, we have to anyway with the forces that are pushing on our work. So I'm happy the transformation is as far along as it is and it's thinking that we can maybe get to some implementation to help us make good decisions about the tough calls we've got to make in the next session and, in the next biennium for sure, because none of that's going to be easy. So lots of irons in the fire. Our community engagement team, I think they're going to be talking to you all and, reporting out on their efforts and getting feedback from you if they're working. But that's another very big reorganizational investment that we've made to try to make sure we have tables that you all are sitting at as we go through all of this. Can we see all the transfer? Let me get the latest and greatest for public consumption, and I will send it out or put it in the chat or something. Beth, that's a good call. Will do. Yeah, Bridget.
Thank you, Claire. Thanks
Oh,
for describing. Do you have any thoughts about how this might help streamline HR requirements between OHA and DHS for something like work requirements? Will the transformation help with that?
I think that won't necessarily be helped by transformation per se, but it's already a huge work product that's happening now already, because you may have heard from our FACT team, our federal action team, and our HR1 team. And so we have reorganized ourselves in sort of emergency fashion around, or emergency services fashion around all of the federal changes and trying to coordinate all of that. So we've got a massive infrastructure that's working on those things right now. So I would say it's happening in conjunction with transformation. It's not a byproduct of transformation. It's already its own really important thing. And I think you'll also get some updates maybe about that today too. So lots going on there, lots of dedicated staff who are, really trying to figure out all the implications. Anybody else have any questions before I turn it back over? Yeah, Beth, I was just reading your chat. I totally agree. It's hard to visualize when I'm doing, hand signals for umbrellas and columns and all that. So um, we'll definitely work on some materials. And there'll be a lot more coming out about transformation too, just generally through our public channels and things. Okay, well, reach out to me anytime. As always, I am happy to bring up any other information that you might ever need ahead of time. If you want to let me know, I'll be at each of these meetings and I can talk about whatever. Let me know. Thanks, everybody. Bill, back to you.
Thank you, Claire. I appreciate it. And again, as this work is progressing, Claire is going to be coming back, and every month Claire is going to be here, and or someone from the director's office, Claire, or her deputy, and there will be an opportunity to hear a little bit more about the transformation, the updates, and where we stand. In the interim, Beth, I appreciate your question. I think it's a very esoteric, abstract concept that we were talking about, but getting something tangible that you can actually see and react to, I think is going to be really fruitful. So we'll commit to give you something that you can see as it's being developed and keep you informed and engaged throughout the process. And speaking of engagement, I did call out the community engagement team that's really going to be focused on ODHS wide engagement, community engagement, as opposed to this kind of community engagement that's somewhat fragmented and disjointed, really trying to be more intentional on the way that we're doing our work. So Cheryl Miller, who is overseeing that, is planning on being here at next month's meeting to talk really about what that means and how we're able to really move efforts around community engagement forward in a much more deliberate way, but also engaging you to kind of get your take, get your inputs, and actually just start you into that process. So more to come on that. That will be next month's kind of primary focus of our discussion next month. At this point, would love to shift gears unless folks have any other kind of questions for Claire and others. Okay. I do see one of our speakers, Misty. It's great seeing you, my friend. So Misty Shoney is going to be speaking with us about the HR1 OHP. She's being joined by Bevan and the SNAP updates. So Misty, I'll turn it over to you, my friend.
Thank you, Bill. So good afternoon, everyone. My name is Misty Shoney. I am the Community Partnership and Engagement Lead, and I work in the Office of Immigrant and Refugee Advancement in OIRA. I will be sharing today the Federal Actions Coordination Team June updates. Maria was not able to join today, and she asked me to do the presentation. So here I am. So let me see if I can share my screen. Um, Is that working? Well, let's go in presenter mode and see how this goes. And then if someone can, is it in presenter mode? I can't hear you.
Not yet, my friend.
No. No? Okay. Let's see. Sorry, it doesn't work the same in Zoom. Let me try that again. Hmm.
I know the technology always is an evil friend when you're in the midst of presenting.
Oh, it's a lot easier on Teams too. Let's try this screen. And, and then how about that?
Still in the notes page. If I do wonder, Crystal or Sasha, I don't know that we have some administrative folks that may have access to the PDF that can maybe present on your behalf and you can just
Yes,
work.
yes, if someone can do that, that would be great.
Great.
Let me grab that real quick.
Okay,
Beautiful.
sorry about that.
Great. So, Misty, would you mind just sharing a little bit, just like what it is that you're going to be speaking to generally about some of the things, the topics?
So I am actually a part of the Federal Actions Coordination team. And so we'll be just sharing the June updates that are coming out. There's some information about SNAP and ABOD changes. And so that will be the update for this month.
I know there were some questions also around the OHP eligibility work
There,
requirements.
I believe there's someone here from OHA that will be sharing for OHA.
Beautiful.
Sorry, everyone. The
Don't
delay.
worry. Is that a person, Bevan, by the way?
I believe so.
Bevan, I'm curious, are you in the room?
I'm here. Yes,
Hey, Bevan, how are you? Good seeing
I'm
you.
good. It's good to see you. Uh,
There
there
we
we
go.
go.
There we go.
Hi.
Great. Bevan, would you like to introduce yourself while we're waiting for the deck?
Sure. So I'm Bevan Inkram. I use she, her pronouns. I'm with the Oregon Health Authority External Relations Division. I'm an innovator agent, and I have been sharing this presentation amongst a large group of folks. So I was happy to bring it here. Maria had asked me to present here. So I'll talk to you after Misty.
Fabulous. Thank you so much. It's good seeing you, my friend.
Thank you.
Good, Misty. It looks like we have your slide deck up.
Yes, we do. Okay, so can I go to the second slide, please? So as you probably all know, SNAP helps people buy food when their income does not cover basic needs. People who use SNAP live in every part of Oregon. They include children and families, older adults, people with disabilities, workers with low wages, and people who are in between jobs or facing a crisis. That is why the federal changes to SNAP matter. They do not only affect individual households, they can also affect local communities, grocers, food banks, healthcare partners, schools, and community organizations. This context is important before we look at the latest numbers in year-over-year trends. Next slide. In Oregon, an average of $183 per month in SNAP is issued out to each individual participant and $313 per household. This slide shows a year-over-year comparison of SNAP participation. In April of 2025, 776,467 people in 455,954 households received SNAP in Oregon. In April of 2026, 707,605 people in 412,852 households received SNAP. This is a decrease of 9.45% in individuals and 8.87% in households. SNAP participation can change for many reasons, including income changes, renewals, eligibility rules, household circumstances, and federal policy changes. We should not attribute the decline to one single cause. This decline is important context because it is happening at the same time that many families continue to face food insecurity and rising costs. Next slide. This is happening in a context of rising food insecurity in the state as reported in the USDA Household Food Security Report published December of 2025, and as reflected in increasing individual and family visits to food banks throughout the state. Next slide. SNAP interviews resumed for all households on June 1st, 2026. A temporary federal waiver allowed some SNAP households to skip renewal interviews during COVID-19 pandemic. That waiver ended May 31st of 2026. This change returns SNAP to standard federal requirements. All households must complete an interview when they apply for or renew SNAP benefits. An interview must be completed before food benefits can be approved. If someone has not received a renewal notice, they do not need to call or visit an office just to request an interview. ODHS will contact them when it's time for an interview. Interviews can be completed in person and over the phone. Partners can help by encouraging people to answer calls from ODHS, read notices, and contact ODHS if they miss a call or need to reschedule. Many people are affected by this change may not have had a SNAP interview since their case first opened. Renewal interviews are a standard part of SNAP and help make sure that benefits are issued correctly. This slide shows what happens after someone is identified as having ABOD status and may need to meet SNAP work or activity rules. First, ODHS sends a notice explaining the SNAP work or activity rules, rights, and responsibilities. If the person receives a full month of SNAP and does not meet the work or activity rules and does not have an exemption or good cause, they receive a countable month. ODHS sends a notice on the 15th of the month when each countable month is used. The notice explains that countable month was used, ways to meet the work requirement, and possible exemptions and how to contact ODHS. After the third countable month, ODHS sends both a third countable month notice and a separate closure or reduction notice. The 3 countable months may not happen back to back. They can happen at different times during the 3-year period. And here is an example of the notice. Next slide, please. In April of 2026, 6,948 people had SNAP benefits close at the end of April due to federally directed changes to the Supplemental Nutrition Assistance Program SNAP work rules. Those closures and reductions took effect at the end of May. The average SNAP benefit for affected cases was about $287 per month, money that would otherwise have been spent on groceries in local communities across Oregon. Based on average benefit amounts, these closures and reductions represent nearly $2 million in SNAP benefits that will not be spent in Oregon communities this month. An additional 6,309 people are currently at risk of SNAP benefits to close or reduce at the end of May. Because these changes could take effect soon, which I think this might need to be updated since we're in June. Because these changes could take effect soon, some people may not be able to prevent a benefit loss a June benefit loss before the end of the month. However, people should contact ODHS. Even if SNAP benefits stop and a person's EBT card does not have June benefits on it, they may still be able to regain benefits by meeting work rules, qualifying for an exemption, or reporting a change in their situation. Next slide, please. If someone's SNAP benefits stopped because they did not meet SNAP work or activity rules, it does not mean they are permanently ineligible. There are ways to get benefits back during the same 3-year period. This is called regaining eligibility. A person may be able to regain eligibility by meeting work or activity rules, qualifying for an exemption, or living in an area where SNAP work or activity rules are not currently being applied. ODHS can help people understand which option may apply to their situation. Benefits do not restart automatically after they stop or are reduced because of SNAP work or activity rules. If a person's benefits were reduced but the SNAP case stayed open, they should contact ODHS and ask to be added back to the case. They will need to regain eligibility before benefits begin again. If the person's SNAP case closed, they must reapply for SNAP. They will still need to regain eligibility, and the benefits may restart from the date that they reapply. Acting quickly can help reduce gaps in benefits. ODHS can review the person's situation, explain options, and connect them to WorkSource Oregon for job search, training, and support services. In June, HR1 implementation work continues across several areas. ODHS and OHA are coordinating messaging and partner engagement because many people may be affected by both SNAP and OHP changes. Partners may hear questions from the same household about both programs, so aligned messaging is important. ODHS is launching payment accuracy supports focused on shelter, utilities, and case review. This work is intended to help people receive the right benefit amount and reduce avoidable errors. Planning continues for chip-enabled EBT cards with a goal of moving towards implementation later in 2026. This is a part of the broader work to protect benefits from electronic theft. New state-funded positions are also moving forward. These staff will support eligibility work, exemption renewals, and customer service as federal requirements increase workload.
Hey Misty, while we're shifting over to the next slide, a couple questions came in the chat. One, would it be possible to get a sample notice that we can share with folks, and then we can post either in the chat or we can share in through email?
So I can take that back to the fact team since I no longer work for SSP, so I don't want to speak for SSP,
Okay,
but I will take it back to the fact team and let them know.
beautiful. And the second question, um, do you know the total number of people that have lost benefits, including in January, March, since the counties were impacted earlier than the rest of the state in April? Do you have any of that data or that numbers, or is that something you can get
Um,
back to us?
we'll get back. We'll get back to you if we can.
Okay.
If someone is collecting the questions, and we can
Yeah.
get back and send it out.
Beautiful. And Beth had a clarifying question. If you can share the full notice, not just the first page, that would be really appreciated. And again, I know you're going to go back to the fact team to have that question, but I think it's a great request.
Okay, no problem.
Thank you. Okay, sorry. I'll go back on mute.
All right. So recent monthly SNAP quality control data show improvement after higher error rates in the fall of 2025. December SNAP quality control error rate was 6.06%. January's rate was 4.84%, making January the second month in a row with a single-digit monthly error rate. The cumulative rate for the federal fiscal year 26 is now 10.41%. The higher rates fell The higher rates last fall were mainly driven by the federal government shutdown that began in October of 2025 and caused November SNAP benefits to be issued late. This matters because HR 1 changes how SNAP costs may be shared between states and the federal government beginning in federal fiscal year 2028. States with a payment error rate below 6% pay no SNAP benefit cost share. States at 6% or higher may pay up to 15% scaled to the error rate. ODHS is continuing system-wide accuracy work, including staff training, updated policy guidance, stronger quality checks, eligibility systems improvement, and customer outreach tools. Mhm. And I think that is it for me. I did want to mention just kind of a reminder, and I think this is more of some messaging that we've been sharing from our office is with the changes that are coming with SNAP, it's going to be important to share with families, especially families right now that are experiencing fear and receiving a notice saying that they have an interview. And so if the messaging can be shared with families that these interviews, are happening for everyone and it's for SNAP, I think that would help just because of all the fear that is going across the communities.
Great. Misty, thank you so much for all the information. And again, there were some questions that were in the chat. We'll be sure to follow with you and make sure that information gets out to this group. And please, for folks on the call, if there are other questions that you may have for Misty or that group, please don't hesitate to put it in the chat, and we'll be sure to capture it and respond accordingly. Um, Bevan, I do appreciate you being here. I'd love to turn it over to you now.
Great. Thank you so much, Bill. I'm going to attempt to share my screen too. We'll see how this goes. Um, boy. Okay. Okay. Does that look good? Everything in presenter mode on your
It's
from what you
not, but it's if you want to go with what you got, if you can make it in presenter mode, that's great. But if you want to go with what you have,
uh so are you showing the what's healthier Oregon slide? Is that what's up?
I'm seeing that, and I see your slides on the left.
Okay. Yeah, it's going from a different screen, of course, than what I wanted. Let me just do this really quick and see if I can get it corrected here. Well, it looks like this is what we have.
Sounds good.
Um, okay. So, hi everyone. I just wanted to share some information regarding program changes for both Healthier Oregon and for the Oregon Health Plan. And thank you so much, Misty, for doing such a wonderful job. And I will probably share some of the same information, but there's a lot going on, so hopefully people don't get too bored with all of this. But the first thing is our Healthier Oregon program. And just to share what that is, it is a program that offers the full Oregon Health Plan coverage to anyone, regardless of immigration status. We're one of the very few states in the nation that have a program that's set up in this way. Healthier Oregon, as I mentioned, offers our Oregon Health Plan benefits, and it is primarily state funded. We do have some federal funding, primarily around emergency healthcare services and pregnancy related services, where we do still receive a federal match. So there is still a bit of oversight by CMS with regard to our Healthier Oregon program. So, what is the Oregon Health Plan Open Card? I think you're all familiar with this program as well, but The Oregon Health Plan provides coverage through coordinated care organizations, as well as Open Card or through a mixture of both. Most of our Oregon Health Plan members do receive their care through a coordinated care organization. I believe many of you are familiar with CCOs, but just in case, CCOs are a group of local healthcare providers that care for our Oregon Health Plan and Healthcare Oregon members by region. And then our Oregon Health Plan Open Card is also known as fee for service, but we are trying to stick to using Open Card because fee for service is also used for other types of programs as well.
Hey, Bevan, real quick, if you're
Yeah.
changing slides, the slides aren't changing, so you may have to manually change them.
Well, that's how about,
There you go. That changed.
oh, it
Perfect.
did. Okay, so it's working off of a different screen. Isn't that lovely?
Yeah.
Okay. So now I'm on the Open Card screen. Do you see
There you
that?
go. Yes.
Excellent. Okay. Thank you so much, Bill.
You're welcome.
All right. So then, what I wanted to cover today were the three federal changes that are affecting our Healthier Oregon program. And these are as a result of House Resolution 1, otherwise known as the Big Beautiful Bill. And these various changes, I'll start with the first here, which is some of our immigrants will move from the Oregon Health Plan to Healthier Oregon. So previously, they met the requirements for Medicaid, but since the federal changes, we have now been told that we need to move some groups over to Healthier Oregon. This change will occur on October 1st of 2026. We will begin notifying those members that are affected in July. And those that are impacted are primarily refugees, asylees, humanitarian parolees rather, and survivors of domestic violence and or human trafficking. This affects about 7,000 members statewide. And as I mentioned, we do plan on providing a notice to those 7,000 members in July so that they are aware of that change that will occur on October 1st of 2026. And then, Bill, if you would just let me know if there's questions, that would be really helpful.
Absolutely.
Thank you. So the second transition that is occurring is we are moving our Healthier Oregon program from the Coordinated Care Organization platform over to Open Card or fee for service. That change goes into effect on January 1 of 2027. We will be notifying the program enrollees of that change in October. They will receive a notice letting them know their benefits and services have not changed. However, they will be moving to Open Card. One of the major changes that are experienced by folks that move from a CCO or managed care over to Open Card is a change in their provider network. And we are anticipating that some Healthier Oregon members may have a few challenges depending on the region and where they reside in accessing the same level of care they've been accessing through a CCO. This does impact about 100,000 members that are currently enrolled in our Healthier Oregon program. And I also want to share that one of the focus areas of the Oregon Health Authority is to ensure that we have the broadest network of providers available to Healthier Oregon members when they are moved over to Open Card. So we are working to ensure that we capture as many of those current providers that are seeing these members through their coordinated care organizations they'll be able to continue to see those same providers once they move over to Open Card. And then the third change is that due to HR 1, and because there is still some oversight over the Healthier Oregon program, Healthier Oregon and the Oregon Health Plan will have the same rules applied to both programs. So that means that many members aged 19 to 64 will need to complete work or other qualifying activities such as schooling, job training, or volunteering. And these rules are the same rules that apply to both programs. And even though Healthier Oregon is primarily state funded, we are applying those same rules across both programs. There's a couple of different reasons behind that. One being, of course, because we were told to by CMS. Another being that we want to keep those programs consistent and it's less confusing. We do anticipate there will be some movement between programs as some Healthier Oregon members may have a change in their immigration status. They may move back over to OHP. And it is easier for messaging as far as ensuring that the same messaging is occurring between both programs. So, as I mentioned, Healthier Oregon is primarily state funded, but about a third of our funding does come from federal sources. So then who needs to meet the Oregon Health Plan and Healthier Oregon work or activity rules? It's those that are, again, adults age 19 to 64. And then those that do not have to worry about the work or activity rules, those that are considered exempt from those rules, are anyone who's under the age of 19, anyone who's over the age of 64, all of our dual eligibles that are receiving both Medicaid and Medicare, and then anyone who has the Oregon Health Plan or Healthier Oregon based on a disability or if they are pregnant. And then additional exemptions include anyone who's caring for a child under the age of 14 or if they're caring for someone with a disability. Also, anyone who is disabled or has a serious medical condition. American Indian and Alaskan Natives are also exempt. And then we are waiting to release additional information specifically around medical exemptions, and I'll talk more about that in just a moment.
Hey, Bevan, just a heads up. We are at 2:52 and the meeting itself. Just want to give you a time check. So,
Great. Thank you so much, Bill. I'll push it through a little faster here.
thanks, my friend.
Okay, so as I mentioned, the exemptions that I already talked about, but I want to just call attention to those that are pregnant or are postpartum. They have 1 full year of exemptions as an exemption. And then in addition, veterans who are disabled are exempt. And people who have been recently incarcerated, they, once are released or from a carceral setting, have a 90-day exemption period. And then any participant in alcohol or substance use disorder treatment is also exempt, and former foster youth are exempt up to age 26. And then, as I think both Claire and Misty spoke to, our TANF and SNAP work requirements, if those have already been met, those are anyone who's in TANF and SNAP is exempt from the OHP work and activity requirements as well. And as far as medical exemptions are concerned, right now we know that people that are receiving care in a hospital, a nursing facility, an immediate care facility, if they are inpatient in a psychiatric hospital or receiving other services of similar acuity, including outpatient care relating to any of those above services I just shared, they are all exempt, as well as anyone who's receiving substance use disorder treatment services, and anyone who has to travel outside of their community for an extended period of time, such as those receiving an organ transplant, as an example, or anyone who's determined medically frail or has other special medical needs. And I will just share that we are still working through a rather large document from CMS to identify the definition for medically frail, and then also around those that have those special medical needs. And then you'll see on the right side there in the blue box, we've already made a determination that the folks that are blind or disabled as defined by the Social Security Administration, those that have a substance use disorder or have a disabling mental health condition, as well as those that have a developmental, intellectual, or physical disability that impairs their ability to perform at least one activity of daily living, are also considered medically frail and would be exempt from the work and activity rules. And the ways in which they meet those rules, again, the household income of more than $580 each month That's based on the federal minimum wage of $7.25 an hour at 80 hours a month. And then those that are at least half-time enrollment in higher ed or high school or in a GED program. And then anyone that works or has a combination of work, education, training, or volunteering, a total of 80 hours in the month. So another large change coming is more frequent renewals. Currently, our 1115 waiver allows continuous eligibility for adults for a period of 2 years, and children up to age 6 are also continuously eligible and enrolled in our program. So beginning in January of 2027, we will move to more frequent renewals for a large majority of our programs for both Oregon Health Plan and Healthier Oregon. Some adults will actually renew every 6 months, and some will go only on an annual basis. All children are also going to be subject to an annual renewal. This takes effect after September of 2027. That is when our current waiver ends. So we will see that those that are newly applying may have documentation requirements about work and activity rules, and also may be subject to the newer uh, renewals as well, the more frequent renewals. Gosh, I can't talk today. Sorry, trying to speed through. So our goals are to keep people covered, and we're working closely with ODHS on messaging, on supports throughout our state. We also have assisters throughout our state that will guide people through this, through all of these changes and help them with any questions they may have. We want to reduce inequities and harm to the people we serve. And we also want to adhere to federal rules, but we're also negotiating at any chance that we have to understand better and to also reduce the challenges to our Oregon Health Plan and Healthier Oregon members. And just really quickly about provider taxes, this is a lot of the reason for the reduction in the actual budget for Medicaid. The federal government's reducing the amounts that all states are allowed to tax providers. And that in turn reduces our federal match and affects the amount of money going back into our healthcare systems across the United States. As a result, Oregon is projected to see a loss of about 12 billion over the next 10 years. And then just again, we were told effective July 4th of 2025, we are no longer allowed any new provider taxes or increases beyond the current rate. And then we're stepping down those existing taxes beginning in October of 2028 with a gradual reduction ending from 5.5 to 3.5 by fiscal year 2032. So you can see that's where those changes are coming from. And then what we're asking members to do is keep their contact information up to date. That, of course, is for both the Oregon Health Plan, Healthier Oregon, and for all of our ODHS programs as well. We do know about 89% of SNAP recipients are on the Oregon Health Plan. So that does mean a smaller number of people that would be responding to us with the work and activity rules, which is, I think, really helpful, reduces barriers. And then if people have questions about the open card enrollment, we have our open card handbook available at this webpage here. And then we also have more information on the open card website. Essentra will be our contracted vendor that will be managing care coordination for our members that are in Healthier Oregon moving to open card. And they are also partners in helping us ensure that those members stay connected to care. So this is how you can stay informed with our web page, and then we also have a newsletter, and you can go to this site here and sign up and have that newsletter drop directly into your inbox. And we also have all of our information on social media as well. And did I make it? Okay.
Great job. Hey, Bevan, one question. Will the frequent OHP renewals be consolidated with SNAP renewals so people have to go through this process less frequently?
That is a wonderful question, and it's something that we are working on. We're trying to figure out the coordination between the timing of when SNAP recipients go through that process. But because we do have the one system, I think there's a lot of opportunity there for our eligibility staff to look up and see when people last went through that process with SNAP. So the short answer is yes. The longer answer is we're working on it.
Beautiful. Well, thank you, Bevan. Thank you, Misty. Claire stepped away, but thank you, Claire. Um, Last one, Beth. Yes, I see you. Will OHA share the proposed notice that will go out to immigrants in July? We really need to see it and give feedback.
Absolutely, Beth. We'll be happy to share that with you as soon as we have it written. I know they're working on it right now. So I know Sarah Dobra stays in touch with you, and we'll make sure that we get that posted so that you have access to it.
Beautiful. We are at 3. I want to thank everyone for your time. Really kind of comprehensive information today. I did drop my email into the chat, so please take advantage of the invitation. If you have questions or comments about today's discussion, if you have any feedback, but also if you have any topics you'd like us to cover or bring into this platform, don't hesitate to reach out to me directly.